Thank you for including JLM and the Jewish community in the Doreen Lawrence Review. It is very welcome that Labour is doing an inquiry so quickly on this important subject, unlike the government, who really should be. The Jewish community was hit particularly hard and early by COVID-19. The number of burials from March to May was 127% higher than in the previous year. That's 811 people lost, in comparison to 358 in 2019. The Office of National Statistics found that Jewish males had a mortality rate of nearly double that of Christian males. We don't necessarily know why the death rate was disproportionate, but factors that have been suggested include the Festival of Purim celebrations in March before lockdown with many communal gatherings, intergenerational living, and a lack of reach of messaging to ultra-Orthodox communities. In August, at the GLA Women of Faith Zoom seminar, a speaker from the Jewish community and speakers from other minority communities spoke powerfully about what this meant for families and communities who lost people, who couldn't be with their loved ones when they were ill, and who couldn't follow traditional mourning rituals, especially holding a shiva. It is important to remember that there isn't just one homogeneous Jewish community, but Jewish communities, and we need a detailed and comprehensive analysis about their different experiences and ways of connecting with them and communicating key public health messages. The London Jewish Forum continues to be a useful model for community discussion with policymakers, bringing together many denominations and organisations with a focus on key themes under COVID, including care homes and social care, mental health, young people, social cohesion, and bereavement counselling. I've recognised a lot of faces on these calls, from the many amazing community organisations from my local area working to support the local Jewish and wider communities. I've been able to see the community impact and response up close in Barnet, where I'm a local councillor, and I've been working with the voluntary community and faith sectors on the COVID response, on the Barnet Together Community Response Fund panel, and with the Jewish Volunteering Network. The community response has been extraordinary, looking after people with food parcels, Zoom activities and services, and interfaith collaboration, including through the local multi-faith forum and partnerships between local councils and charity and community sectors. For me personally, one of the most special and moving moments during the pandemic was when area connectors from my synagogue brought collections from across the borough to the pop-up food bank in Birdhoek, where I'm a councillor, reflecting the Jewish concept of tzedakah, which does mean charity, but also social justice. So there has also been a focus on Jewish voices speaking up to help address structural inequalities that have affected COVID incidents for other communities. I and other JLM members joined a local standing protest organised by young Jewish people in support of Black Lives Matter, and there have also been many community Zooms exploring related issues, as well as an initiative by members of my synagogue establishing a non-faith-based joint refugee action network, bringing together many national, regional and local organisations. Going forward, to help address the disproportionate impact of COVID on minority communities, it would be good to look at establishing very localised faith and community-based emergency response networks, possibly at the ward level, as well as a network of trusted community connectors or champions for crucial reach and dialogue in different denominations and groups within different communities. It would be good if the new Health Champions initiative can be shaped to help facilitate this. Particularly for disproportionately affected communities, it is vital that we all follow public health guidance to protect our communities and to save lives.